Welcome back. A team of Hawaii medical experts are in Samoa to help save lives during the deadly measles outbreak. So far, more than 4,000 people have gotten sick. 60 have died, most of them children. Measles is highly contagious, but preventable with the vaccine. Here at home, the Department of Health is warning travelers to be alert as international outbreaks continue to rise. Joining me now in studio, we have Bruce Anderson, the director of the Hawaii State Health Department. First of all, thank you for joining us. What can you tell us about measles here in the state?
Well, thanks for having us here, Bridget. Measles is very active now in the entire Pacific area. There's a lot of focus on Samoa, but the truth is we have outbreaks in Fiji, in Tonga, in New Zealand, some in Japan, and what most people don't realize here is that a lot of measles circulating in the United States, the continental United States. It's a major issue as vaccination rates go down. Here in Hawaii, we've been lucky. We've had only 4 cases this year. We had none last year in 2018. 3 of those were visitors coming here, got sick when they were in Hawaii. Fortunately, they didn't transmit the disease to anyone. And 1 was a Hawaii resident who got sick on the mainland and got better before he came here. We count that as a case. So we've had only a few cases here, probably because of our high vaccination rates.
So is this something that we need to worry about for those of us who live here?
Certainly. We need to keep being vaccinated. That's the only really effective way to prevent illness. You forget often that, 100 years ago, the Hawaiian community was wiped out by measles and other infectious diseases. They didn't have a vaccine then, we do now. We're especially interested and concerned about travelers, people who are going to some of these areas where there is active virus circulating.
I know we talk about Samoa, but as you were mentioning, it's not just in Samoa. So speaking of traveling, with the holidays coming up, a lot of viewers, a lot of folks out there are going to be doing just that. Any advice for those travelers?
Sure. Of course, one thing I would say is get vaccinated. Check your records and be sure that you've had vaccines. If you don't, see your physician or a medical provider. Typically, we vaccinate, they will want to be sure that people who are children who are between 6 and 11 are vaccinated, if 11 months old, I should say, are vaccinated before they go on and travel. And for children over 12 months, you should have 2 vaccine doses at least a month apart to effectively prevent the disease.
So if you're unsure, you could just get checked.
Get checked, and you should remember it doesn't hurt to get vaccinated again. It just helps to assure that you do have antibody and that you are immune to the disease.
So what is the health department doing to try and prevent and control a possible measles outbreak here in the state?
Well, first of all, we vaccination and assuring that someone is immune is really the only effective way. For anyone born after 1957, we recommend the same vaccine schedule. Again, kids should be vaccinated. Most physicians will do that after 12 months. And people like me who are over 57 are probably immune because we were exposed. I was born, and people after 57 years ago were probably all exposed. At least 98% of us have naturally occurring immunization because we were infected. But for anyone else, it's important that you get vaccinated. It can be a serious disease. As you pointed out, Samoa is suffering from an outbreak. 60 kids to date have been killed by a disease that was not common many years ago.
So it can be preventable.
And is entirely preventable through being vaccinated. It's a team effort to prevent this disease. First of all, the physicians, if they do recognize a disease, will report it to us. We follow up on every report. We take it very seriously. We'll find out where that individual was, who they were in contact with. If they're on a plane, we actually go and look at the manifests in the plane to find out who was sitting around the individual. And we'll contact those individuals and find out if they have had illness or any problems that we're aware of. And of course, alert them that they were near someone. And we also work with many other healthcare providers. We actually provide services to many of the other Pacific Islanders. In fact, just today I was called by Lieutenant Governor Green and asked if we could help in Guam. They had a big storm and their lab's out now, so we said we would be glad to help with supporting the testing requirements for the program.
Well, thank you for all that you do and for all the important information. Thank you for being with us tonight.
Glad to be here.
Bridget, send it back to you.